Well, hey, everybody, this is Robert, and welcome to Outbreak News TV. And today, what I want to take a look at is the latest on the dengue fever epidemic going on in Brazil. And to take a look at some of the latest numbers, we see that as of March 8th, that's from January 1st to March 8th, there's been 1,342,000 total dengue fever cases. Suspected, probable, and confirmed. In addition, there's been 363 confirmed fatalities from dengue fever, and then there's another 763 that are under investigation. So the numbers are really going through the roof during the first 8 or 9 weeks of 2024. In addition, there's been 9 states that have declared an epidemic and declared an emergency over dengue fever. And about 200 different municipalities have also. So it's really quite a situation going on in Brazil this year. Now, there's been the federal district, which includes Brasilia, Acre, Goiás, Rio de Janeiro, Minas Gerais, Espírito Santo, Santa Catarina, and Sao Paulo are the states that have already declared public health emergencies. And data from the Ministry of Health's Arbovirus Monitoring Panel show that at least 5 states and the federal district have already accumulated more dengue cases in the first weeks of 2024 than in the entirety of 2023. And this includes Amapá, Amazonas, Goiás, Rio de Janeiro, Roraima, and the federal district, which includes the capital city of Brasilia. Well, the Minister of Health, pictured here, said that together with the technicians and specialists, on Tuesday, she said that the scenario of dengue cases and deaths in Brazil are really, really high, as we noted in the numbers. And she highlighted the acceleration and really put the blame on climate change. But she didn't go any further. So I couldn't find anything else to follow up with that proclamation by Health Minister Nacia Trindade. But that is what she said. And she reinforced the union with states and municipalities will be valuable in the fight against the Aedes aegypti mosquito. Quote, campaigns were carried out to combat mosquitoes in previous years. This time, however, an important point is this strong synergy between the ministry, state, and municipalities and through their councils. This is very important because the MOH would never be successful if it only thought about cabinet actions. Now, during a presentation to journalists, it was announced that the ministry would be also issuing a technical note recommending expanding the age range for the dengue vaccine. Other than the cases and deaths, the dengue vaccine is the other big story going on in Brazil. And we're going to jump on that a little bit. But just to give you a little idea of what's going on, the number of people bringing their children in to get vaccinated are much lower than they were expecting. And so they're recommending, not even recommending anymore, they've already done it. They've expanded the vaccination age with the Qdenga dengue vaccine from 10 and 11 years old. Now it's all the way up to 14 years old. A study was carried out by the MOH apparently, and they established that that's the way to go. In addition to vaccination, we have 2 focuses: prevention with vector control and care through our health care network. Explained the Secretary of Health and Environment Surveillance, Ethel Maciel. Now, a lot of a lot of resources are being put into the states and into the municipalities from the MOH. And this includes, and I have that up on the screen, uh, 300, almost 350,000 serology test kits, 177,000 molecular biology kits, 41,000 kilograms of larvicides, and 139,000 liters of adulticides used in fumigation. So to date, the Ministry of Health has already allocated 44 million real to support the local managers to combat this dengue epidemic. So about 7 million went to the states, about 6 million went to the federal district, and another 32 million went to the municipalities. The financial support will be allocated to measures to prevent, control, and contain risk, damages, and harm to public health. Right now, financial aid has been granted to Minas Gerais, Goiás, the federal district, and 79 other municipalities, including Rio de Janeiro, Sao Paulo, and some of the other larger cities. Now, since 2023, the Ministry of Health has been constantly monitoring and alerting epidemiological scenario of dengue in Brazil, coordinating a series of actions to combat arboviruses throughout the national territory. And I'm flipping the page right now. There we go. Now, the department acquired the available stock of dengue vaccines from the manufacturing laboratory, which is Takeda, who makes the Qdenga vaccine. And between last month, February, and the end of the year, 5.2 million doses will be delivered. And then in 2025, it's going to be like 9 million doses were available for purchase, and Brazil purchased them. And they're still open to acquiring more if new availability of doses exists. Brazil's MOH also established an emergency operations center against dengue, the COE dengue. The initiative, coordinated by the MOH together with the states and the cities, aims to accelerate the organization of surveillance strategies in face of the increase in cases in Brazil, allowing more agility in monitoring and analyzing the scenario, and to define the appropriate and timely actions for the tackling of the disease throughout the country. And the data that we see that I published on here on one of the first slides is from the COE. Financial contribution to the federative units was made possible through an ordinance that the MOH published to optimize the release of resources. So, like I said, Brazil is pumping a lot into this dengue epidemic. So this is for any emergency, whether it be if you declare an emergency against dengue, say chikungunya, or anything else, any situation that could affect public health. And to receive the funds, the state or municipality must send a letter to the federal government declaring a health emergency, and the transfer of funds would then be approved. It's also necessary to get the money to present an action plan, which must contain a presentation of the local health condition, considering the epidemiological situation, the need to serve the population, and the overload of the care network. And also detail the health actions to be carried out and the respective estimated values. So, yeah. So just to get the money, you just can't say, I need the money. You have to come out there and really show that it's a necessity. And like I said in the beginning, that the dengue cases, the dengue fatalities are already, through the roof for the year, and it's only March 9th today. But one of the issues that they're having is the uptake of people taking the actual vaccine that's offered to be provided for. And there's a very low demand so far, and it's leading to the expansion of the vaccination age range, which I discussed. Um, of a total of 1.2 million doses distributed by the federal government to 521 municipalities so far, only 250,000 dengue vaccines have been administered to date. And this was data that was uh, published to journalists on Friday. The director of the vaccine immunization program highlighted that the department distributed a number of doses to children for ages 10 and 11, but given reports of low demand for immunization and doses approaching their expiration date, which I think is June 30th, the ministry chose to expand the age group to receive the vaccine at this time, which will also include teenagers ages 12 to 14. And this group, actual children and adolescents ages 10 to 14, account for the highest number of hospitalizations due to dengue. So they are the target audience for immunization. Now, they're calling out the parents too. There's a pediatrician from Brasilia who came out and said, I would like to issue an alert asking parents who have not vaccinated their children to look for the vaccination so that Qdenga, the dengue vaccine, can be administered. She says it is a dengue vaccine made with the attenuated virus, a very safe vaccine. It has been developed by the Takeda laboratory even before the COVID pandemic. So it's not new, and it was not developed hastily. And there are already several studies and has gone through all kinds of stages through these studies. The pediatrician goes on to say that the complete Qdenga vaccination series, the 2 doses, guarantees about an 80% effectiveness, and that the side effects, including in children, are small, especially when compared to what dengue infection can cause. While there isn't a private network room, it was a vaccine that back when the vaccine was privately available, there was a cost on average of 400 to 500 real. But now the vaccine is available at the health centers free of charge. She's telling you there's nothing out of pocket. It's being taken care of. So she wants, or she's urging, shall I say, people to treat this as a matter of urgency and get their children vaccinated. So that vaccines are right now a problem in Brazil. They have plenty, but a low demand to date. And we'll start with Rio de Janeiro. This is one example. The city of Rio de Janeiro began Thursday vaccinating against dengue in people, young people, 10 to 14 years old. This is the new target audience. And Rio, the city of Rio, and the state have really seen quite a climb in dengue cases. There's been about 105,000 dengue cases in the state, and about half of that is just in the city of Rio de Janeiro. So it's really, really a problem. So what they're hoping to do is, since the start of the campaign that started on February 23, 48,000 doses of the vaccine have been administered with the objective to immunize 345,000 young people. So right now they're expecting to vaccinate 90,000 children this week. The fact that there's some hesitancy, officials say it's not totally surprising. The vaccine is new, and it's, the adherence is low at the beginning of something like this, but they're saying, parents, the vaccine is safe, and we're encouraging you to come out, get your children vaccinated against this disease of 4 different serotypes, which the vaccine will cover. The Qdenga vaccine from Takeda is available in all 238 primary care units in Rio de Janeiro. To receive the vaccine, the minor must be accompanied by a guardian and present an identity card or birth certificate. The vaccine schedule is 2 doses with an interval of 3 months between them. Yeah. And let's go ahead and go over to another state that's experiencing very similar things, and that's in Piranha State. And there's been about 105, all 30 municipalities since Thursday have been selected to offer the dengue vaccine expansion. So from 10 years old to 14 years old. The state government said to follow instructions from the technical note, which we're going to get to in a moment. The expansion of the vaccination also takes into account the low demand of the vaccine in the municipalities. The DOH in Piranha says that only 23% of the doses have been received out of the total. So there's been about 8,000 doses administered out of 35,000 available. So, yeah, so they're having a problem getting the kids vaccinated. There's no doubt about that. And how bad are things in Piranha State? Well, it's the state with the 4th highest incidence of dengue. Not raw numbers, but the incidence. So there's about 1,100 cases for every 100,000 population. And that's only followed by 3 other cities in, states in the country. So in addition to Piranha and Rio, Acre, the Federal District, Goiás, and Mato Grosso do Sul also expanded the age range. So we'll see if that makes any differences, and hopefully these kids can get vaccinated, and hopefully these vaccines don't go to waste. Now, there has been some issues with vaccine reactions, and the MOH has published that information. And they're saying since the start of the vaccination campaign against dengue in Brazil, the MOH's pharmacovigilance system has recorded 529 notifications of adverse events, possibly associated with Qdenga. So within a universe of 300,000 odd doses applied. According to the Minister of Health for the National Immunization Program, more than 80% of the reported events are classified as mild or common. A bunch of them were about 70 were allergic reactions to the vaccine. Some had some immediate hypersensitivity. A lot of them were local reactions like redness and itching. There was a handful of more severe cases, 16 of anaphylaxis or more intense allergy, and 3 of the patients presented with shock. That's from the MOH. So this prompted the MOH to issue these guidelines that you can see on the screen, or a technical note, they call it, concerning what health professionals should do when they're doing these immunizations. Like, always ask if the person has a history of allergies. If there is a history of allergies, apply the vaccine and ask the person to wait 30 minutes for observation. If there's no history of allergies, administer the vaccine and ask the person to wait 15 minutes for observation. When a person returns to receive a second dose, ask if there is an allergy maybe later on during the first dose. And they're telling the health officials, and they're telling the public, don't seek out vaccination outside of the system where you may not observe possible reaction. There are vaccinations on vaccine. Quote, for the Ministry of Health, the vaccine is considered safe and effective. The vaccination strategy continues. The pharmacovigilance system will continue analyzing the data. And obviously, we will continue with our surveillance, they said. So we'll see how that goes. It doesn't say anything of any deaths, so I'm assuming there were no deaths. But yeah, they had at least 3 severe reactions if shock was the reactions.